Hi, Joyce.
Now,
Nice
okay.
background. Thank you so much for joining. My name is Naomi Matos. I believe I've met most of you. I'm the press attaché at the U.S. Embassy here in Accra, and I'm joined by my teammate Joyce Asedu. You guys all know her, information assistant for the public affairs section at the embassy. And we have a team out of Paris, ARS-Paris, or African Regional Service, Odile and John Ives that are providing support. And of course, we have the guest of honor, our speaker, our international trainer, Sarah Wachter, who will be here to present on reporting on COVID-19. This is the first of a 3-part series. Today, she'll be talking about the basics of reporting on COVID-19, data, using data and best practices. So before we start, if you have not done so already, please put your full name and media outlet into the chat box. And if you'd like access to this presentation, please also include your email address. All right. So like I've been saying, I'm gonna keep everyone on mute. And if you have any comments, any questions throughout the presentation, please utilize that chat box. We will be moderating those questions and saying them on your behalf so that Sarah can answer them. All right, so I see that we have a lot of different regions represented. We have Volta, we have Northern, Western, Accra. Thank you guys so much for coming. I think we have Bono as well. So I think we're going to get started. So without further ado, I'd like to introduce Sarah Wachter. I know that many of you already know her because she was here in person in Ghana last year, where she talked about electoral reporting in the age of politicization and the effects on gender bias and the importance on gender balance in the newsroom. She is back. She is a decorated and experienced journalist. She's worked for the likes of the International New York Times. She's also worked for the Wall Street Journal, The Economist, Economist Intelligence Unit, CNBC, to name a few. She regularly teaches courses on business and investigative reporting, including for the Thomson Reuters Foundation for Journalists in Francophone Africa. And like I said, she was here before last year, so she is a familiar face to many of you. She holds a master's in science from the Columbia University Graduate School of Journalism, and she is here today to open up our 3-part series on COVID-19 reporting. And it is our honor to have her here, so thank you so much. And now I will hand it over to Sarah. Sarah, welcome.
Okay, well, I'm delighted to be with all of you in Ghana again today. And I hope to come to Ghana in the not too distant future. Just briefly, I'll touch on my health background. I guess like war reporters, we health reporters have major events that we cover. And I have to say that COVID-19 is my 3rd epidemic that I've covered as a journalist. I started as a health reporter. In the United States, we have probably a century of experience of developing specialist journalists who cover health. We have a long tradition. I used to work for a national health magazine, and during that time, I covered my first epidemic. At that time, it was HIV/AIDS, and I covered it globally, as well as what was happening in New York, where I was based at the time. Sadly, New York alone, and we now see New York as a hot zone again of an epidemic. New York during HIV/AIDS lost almost 100,000 people. I then also, the second epidemic that I worked on was Ebola. I actually did a project for the African Development Bank. I went to Liberia with a photographer after Liberia was declared Ebola-free, and we traveled around the country in the bush, in Monrovia, to where the first hospital was, where the first case was diagnosed. And we met and talked with and photographed people involved in every aspect of the disease, from the people who worked the crematoriums, who had to incinerate the bodies, to the researchers at Emmanuel Hospital working on vaccines, to the farmers who were very, very badly affected in the bush. It was a really interesting project. So I'm delighted to be here with you today to talk to you about data as the first part of this three-part series. As you know, getting the data story right is absolutely crucial to understanding how this disease is spreading, who's getting it, who's not getting it, and for governments and policymakers to make the right decisions at the right time to prevent this pandemic from overwhelming our countries. As you know, the story in Ghana right now and the story in Africa in general has been to this point that the disease came a little later to Africa. Governments were able to put in place, as they did in Ghana, very strict measures very early. And one of the things that we now know about this disease is that that's one of the most important things to do, to put in place very strict quarantine measures to stop the spread of the disease. However, the story for Ghana and the story for Africa is not over yet. This disease has taken many surprising twists and turns. I, as a journalist, probably now spend close to 2 hours a day just keeping up on what's going on around the world, what's happening on research, what's happening with cases, trying to find out who knows what's going on has become a regular part of my work. Unfortunately, already this morning, the disease has taken a couple of very dramatic twists. Latin America has become a new hot zone, especially Brazil and Peru and Ecuador. This is something that has only cropped up in the past week. Russia now is reporting the third largest source of new infections. Again, this is something that we're seeing quite recently. And thirdly, for a while there, and of course, researchers and doctors are just learning as they go about this disease, we now realize that children are not immune to this disease. They are getting a different version of the illness. It's starting to crop up in New York, and they've now discovered that children are actually spreaders of the disease. So one of the things that we need to talk about when it comes to covering this pandemic, this is a very rapidly evolving situation. Things that I could tell you today could change in 3 days' time. So we need to, as journalists, keep up regularly in our reading of what's happening in all the different aspects of the disease, and we will talk about that. So today we're going to talk maybe about what can be the driest thing for journalists, which is the numbers. But it's a very important part of this pandemic is understanding what these numbers mean, knowing how to pose the right questions of health officials and doctors, and understanding this data so that you know how this disease is spreading throughout Ghana. So Naomi, are you going to put up the PowerPoint and we'll start talking about it? So today will be a data day, and then we'll talk about what will take place on the second and the third day, and then we'll launch into the data part of the discussion. What we will do is today, during these 45 minutes, is I will stop after every module. We have 2 or 3 different modules, and take a couple of questions. So we need to move back to the first slide. Yeah, there we go. So today will be best practices on data. Next slide. The second part of what we will be discussing, the second one, we'll talk about depoliticizing coverage in Ghana. How do you depoliticize the coverage of the pandemic? This has been a very hot issue in many countries, countries that are facing elections like Ghana, and even countries that are not facing elections, political leaders turning this into a political football. How do you stay nonpartisan when the leaders in charge of this pandemic are twisting it for their own self-interest? Also, we're going to talk about misinformation and rumors. This pandemic is now also being called an infodemic. What do you need to know as a journalist, how to handle misinformation? I'm going to share with you some of the best practices on that. And the third part is, how do we hold leaders to account? What are some of the best practices in what is called solutions reporting? Solutions reporting is a movement that has started in the past decade. It was started by 2 journalists from the New York Times. Journalism tends to focus very much on problems and maybe not enough on solutions. There's been a whole movement to move in a direction of solutions. What are the critical issues that you must make sure to cover on a regular basis, including Ghana's health infrastructure plan? And most importantly, moments like these this is a historic moment. We will never, perhaps in our lifetime, see a moment as important as what we're facing in this pandemic. And we as journalists are part of helping to set the agenda for what needs to change in every country, in our health systems, in our political systems, to make our societies and our economies more resilient and more inclusive. So that's going to be the way in which we're going to do parts 2 and 3. So next slide. So the first thing is, as you know, there's lots of research going on. There is an incredible race, probably to me in my lifetime, the greatest scientific race in our time is going on, trying to find solutions to a cure for this pandemic. Will it be a vaccine? Will it be treatments? We don't know at this point. But I thought perhaps the first thing I should do is review with you what are the different kinds of studies that you're going to hear about, that you need to find out about in detail. There's about 4 different kinds of research that is being done. The first one is called randomized, double-blind, placebo-controlled studies in human beings. In the work of medical research, this is considered the gold standard. If you want in the United States to have a drug approved by our regulator, the FDA, you need to actually conduct quite a series of these studies to show that your drug is effective. And what that means by randomized means that in a hospital where this treatment is taking place, on 200 people, 200 people are picked at random from the population that they've identified. What double-blind means is that a treatment which will be given to a certain population, both the person who gives the treatment as well as the patient who receives it, neither one of them know whether they are going to be receiving the actual treatment or a placebo, which is just basically a pill with a bit of sugar in it, let's say. And this is done so that no bias can take place either between the person who is giving the treatment and that person who is receiving the treatment. That's the gold standard, what we called clinical trials. Then another type of research is population studies. Now, I'm just mentioning this in passing. This doesn't really apply so much in this pandemic. Population studies are done more to look at the prevalence of different types of usually long-term diseases like heart disease, diabetes, large studies of populations that are done over long periods of time. There may at some point be population studies that will be done on this pandemic. Of course, also animal studies, usually in rats and mice, typically are the best studies to look at how a particular treatment could be effective. But of course, if a particular treatment is shown to be effective in an animal study, that doesn't mean that it will necessarily be effective with humans. So usually that's something that's done before a disease is actually then tested on a human population. And then there are lab studies where they will take a particular substance and inject it into a cell culture in a petri dish and study how it affects cell types. So these are the main types of scientific research that you're going to come across. Next slide. So this is an example of a story. One of the things I want to make sure that you know is that during this pandemic, most of the major news organizations in the United States have dropped their paywalls. And this is great because as journalists, you have access to the very best journalism and coverage that's being done of this disease so that you also can develop as a part of your regular research and learning. You can go and you can see how journalists put together their stories, the questions they ask, the kind of sources that they use. You can learn a lot by analyzing some of the best reporting, and I'm going to actually tell you who those are. So let's say, for example, here is a piece that came out recently about some treatments that are being used on the disease with llamas. So what kind of questions should you actually be asking a scientist who's working on a research study? The first question is, why did you select this particular research method and this particular research study? You know, why did you pick this animal in this case? And why did you pick this method? Why is this the most effective way to study through this method? How is the study conducted? You know, on how many animals, for example? And when do you expect the first results? Typically, research studies have an initial result, and then they have a more definitive or final results. And then, of course, when do you expect the final results? And how will you make those results public? You need to know that as a journalist because you need to follow up on that. And then after the research is done, what are the next steps that you need to actually verify that this particular treatment is effective? Are additional studies needed? And then there's also research data, and this is really the heart of the research, is how effective was this treatment? If, for example, in this case, a treatment was given to 120 llamas, how many of them were cured? And how long do you think that this cure will last? Is it going to be permanent? Will it last for 2 months? So these are the kind of questions you need to ask researchers. And then if this drug is successful, how long do you expect it to last? And are there any side effects? This is also very important. There are often side effects to drugs. And then if this becomes a successful treatment, how long will it take until this drug is approved by the regulatory authorities in the country? So these are some of the basic questions that you need to ask. There are, as you know, in many countries in Africa now, there are many governments like Madagascar who are discussing the possibility of using herbal treatments. These are the kind of questions that you need to find out. Is there a public research institution in Ghana, for example, if they come up with a folk treatment that they think could possibly alleviate one of the symptoms of the people who suffer from COVID? You need to find out who that research institution is, find out the authors of the study, and these are the kinds of questions that you would need to ask to find out whether or not this treatment is effective. This morning, I read an article that there are now more than 250 different treatments that are now being researched on COVID, and there are over 99 different substances that are being researched as possible vaccinations. So there's an enormous amount of research that is happening right now, but we need to do our job very rigorously to hold and give our readers an idea of exactly where we stand on a particular piece of research. Next slide. So here's a couple of answers from this particular story on llamas. Why llamas? You need to answer that question. So scientists have long turned to llamas for antibody research, for example, in HIV and influenza. And then how was this research actually conducted on this llama? Well, they injected, in this case, they have one candidate, a llama named Winter, with spike proteins from the virus. This was the virus that caused the SARS epidemic. And then they tested a sample of the blood in the animal. So you need to know actually how is this research conducted? And then the last one, how do researchers think that this could possibly serve as a treatment? They are hopeful that the antibody can eventually be used as a prophylactic treatment by injecting someone who is not yet infected. So you see how this journalist, Gina Kolata, who's one of the best health reporters in the United States for the New York Times, she answers all those questions. So this gives you an example of what really good health reporting looks like. Okay, next slide, please. Okay, so any questions a little bit on research and research questions that you have that you'd like to ask through the chat function? If not, we'll move on.
Yes, so please be sure to continue to put in your comments and questions in the chat box. If you're having trouble finding the chat box, please just touch your screen or move your cursor to various parts of your screen to see if you can get it to have it appear, because I know that sometimes when your screen is full of a presentation, the chat box doesn't automatically appear. So I know some of you have been active, but I haven't gotten any questions yet, Sarah, so we can move on.
So one of the principles for us as reporters in the U.S., and this I learned when I first went to graduate school at Columbia, and I think this is very important in health reporting. Imitate the greats. Read COVID articles by veteran health reporters and outlines the questions that they ask and see the way that they answer them. That's how we are constantly improving our reporting techniques, and also outline the story structure. For example, in health reporting, often the first half of an article will talk about the problem itself, and the second part of an article will talk about the solution. So, really study some of these articles. This is one of the best ways that you can become a good health reporter. That's one of the wonderful things about being a journalist. Our work is public, and especially right now with the paywalls being dropped, you have an opportunity to study what some of these journalists are doing. Next slide.
So Sarah, while I click the slide, we did get a question from Mutala up north.
Okay.
He says, in places where there are no research institutions testing drugs, how to report on claims by herbalists?
When there's no research.
Research institutions.
I think you need to talk to experts who work in your research institutions nonetheless. There will be specialists who work on herbal treatments. You need to develop a list of who those experts are. Not everything is going to be researched, you're right, but perhaps there are population studies that exist on some of the different herbal remedies that have been around in Ghana for a while. So I think what you need to do is develop a list of who those researchers are. They could be in private research institutes in the country, or they could be in public research institutes. They could be working for companies that actually commercialize these treatments. They may have researchers on staff, although of course, be very careful with private companies whether or not the research could actually be independent. It's probably better to stick to the independent institutions to get that kind of information. So I think you still need to hold them to a certain standard and be very skeptical about whether or not these things are showing any promise. For example, when I was in Liberia during the Ebola crisis, I was in a part of the bush where there were two towns, and both towns had lost half of their villagers during Ebola. And one of the villages was claiming that they actually healed themselves by living in the bush and drinking lots of water and eating one of the plants in the forest. Well, that's very interesting. But that's what we call anecdotal evidence. It's not based on science. So I think you need to find out who those scientists are in your country that actually study herbal remedies and find out what kind of evidence actually exists that this worked. In this case, there may be population studies. There may be a past herbal treatment that was used perhaps for another epidemic that may be comparable to COVID that might be interesting to study. But I think you have to stick as much as you can to what scientists and researchers would be able to tell you.
We also got another question along those same lines. So if this jogs any additional thoughts on the topic, please feel free, Sarah. But this one's from Marie. Currently, there's no drug proven to cure the virus. What do we do with claims by people, particularly herbalists or herbal medicine practitioners, on having found a cure?
That's a very good question. I'm glad that you asked that. I think that you have to be very careful. There's a lot of people out there making a lot of claims. And you don't necessarily want to give these people space in an article, per se, unless you have talked to doctors and researchers that know something about this particular treatment and can say something. I would be very skeptical about talking about a lot of these things unless you have scientists and researchers who can say, well, this won't hurt if you take it in a certain quantity, let's say, like, for example. But even still, you need to have doctors, medical doctors, tell you exactly how much a person should be taking over what period of time. You have to have doctors who would actually be able to prescribe what that amount would be. And I think to provide balance in your article, I would instead talk about what we do know that can help with this disease. Of course, we know there are no cures, but what are the best things that people should be doing right now? And unfortunately, as boring as it is, you need to go back to best practices. You know, here are the symptoms. If you have these symptoms, you know, you should isolate yourself for the number of days that are required. If your symptoms get worse, you need to do this, you need to do that, you need to get plenty of rest. You need to fall back on what they should be doing to stay healthy. So I'd be very skeptical, and I wouldn't do any reporting until you have actually talked to specialists who can give you some kind of direction on this. not in any, and I would actually emphasize this, under no circumstances should you repeat what these people say, like you should be drinking grain alcohol every night with your dinner. Under no circumstances, I think, should you report on that unless you've had medical professionals who are completely familiar with this, who could say something. The problem is that everybody wants to be cured from this disease. It's capitalizing on everybody's fears and desires. And there's a lot of phony people out there peddling all manner of things. And some of them can hurt people, can kill people. So be very, very careful. Okay.
Oh, right. I think we can move on. We don't have any additional questions at the moment.
Okay, let's move on. So imitate the greats. So who are the greats? I'm just going to give you three. There are many, but these are three that I think are particularly relevant to this session today on data. The first one is Donald McNeil of the New York Times. He is their veteran pandemic reporter. He's covered 6 of the last pandemics. I follow everything that he writes these days because he has this long experience of pandemics breaking out all over the world. Gina Colada is another very, very good New York Times science and medicine reporter. She's written a piece actually that I would suggest that you read that appeared on the 10th of May. We're going to talk about this in the solutions part on part 3 on how pandemics end, which is quite interesting. But her reporting is superb. Another one, and we're going to talk about one of his articles a little later today actually, is Ed Young of The Atlantic. He's doing a lot of the in-depth coverage of the science of COVID-19. Absolutely superb. The work that The Atlantic, this is a terrible moment in the world, but I have to say that I have been really impressed by some of the reporting that I have seen on this pandemic, and these are 3 people to watch. So please take advantage of this moment. Print out their stories. Save them in files in different subject matters and in outline and learn from, imitate the greats. Okay, next slide. So I was looking at the health statistics that the Ghana Health Service provides, and I've looked at what's being provided in the United States and other countries. I want to just give you a quick tutorial of these statistics and what you need to know about them. As I said, COVID is a very fast-moving story, and countries, unfortunately, we had an opportunity in the United States and elsewhere to be prepared for pandemics, and nobody has really been prepared for this. And even the story of data is a fast-moving story. Understanding the data, getting good data, getting accurate data, getting timely data is a real problem everywhere. And I think you should know that all the indicators that we have are what we call lagging indicators. That means that if you hear of the number of new infections, the number of deaths, the number of people in intensive care, all of these are called lagging indicators. We don't really know the actual infections today in real time. Nobody knows that. But certain indicators will give you a snapshot that is more current than others. One of the best snapshots is the number of new infections, which usually is published every day. But it is a little bit lagging. But the number of new infections is probably one of the most important indicators for you to know and get a snapshot of what's happening now. The number of deaths, however, is an even more of a lagging indicator than the number of new infections. And we don't really know. No statisticians can tell you what the lag is between the time that someone is infected and the time of that death. But what I can say is that some of the best statisticians are using a 21-day lag time between infection and death, because that allows for symptoms to develop, seeking medical help, spending time in the hospital, and possibly going into intensive care. So that's probably the most lagging indicator. So you just kind of need to know what's behind these numbers. Another very important number to follow is how many patients are in critical care, what they call, of course, intensive care units or ICUs. This is very important to know because this is an indicator of what kind of stress is being put on the national health system. When people get very, very ill with this disease, the only way that they can hope to recover is by receiving treatment in an intensive care unit. This is now involving not just ventilators. It's not just a problem of lung problems, but now patients are going into heart failure, they're going into kidney failure. They need a lot of these intensive care services. So it's important for you to find out in Ghana how many intensive care beds are there in the country. For example, here in France, there's about 5,000 intensive care units. Because when the number of people, and we have a statistic here, which is the number in critical care. So that's one of the statistics here that the government follows very closely, which is that number in critical care starting to go down in some kind of a meaningful way? And that's something else to know about the data. If you look at the data every day, some days it may go up, some days it may go down. It doesn't really matter the change that is happening every day. It's more the change that happens over a period of weeks. You will see some differences in the numbers. It's not going to be a linear pattern by any stretch. So you need to know how many critical care beds that you have. Another thing that's important to know, and this is very important to know as countries start to ease their restrictions and their lockdown measures, and that's what's called the reproduction factor. That's the average number of people who get infected by every new infected person. And that tells you whether or not, it's called the RO. And that tells you whether the disease is rising too fast again, and whether or not the government needs to come back and put more restrictions into place. In an ideal world, that number should be 1.0. However, we're not living in an ideal world. In Germany, for example, Germany has recently lifted restrictions. Things seem to be going in the right direction. But since they've lifted restrictions, that number has gone up from 1.0. And the government's not sure what they are going to do about it. It has gone to 1.7, 1.13. But that number is being watched very, very closely to determine whether or not they need to put in place restrictions. And then just one final number to understand, and that's, what do you mean by exponential growth? You've probably heard this before. People are talking about the exponential growth of COVID. What does that mean exactly statistically in numbers? That means cases doubling every 2 to 4 days. That's the technical statistical definition of exponential growth. One of the things I just wanted to point out, which I thought was kind of interesting, I'm just mentioning this to you as a health reporter as something to look into. Ghana doesn't seem to be as yet in any position of exponential growth. But however, cases seem to be rising a little fast. They're still relatively at a low level. We're talking about 3,000 cases now versus 1,049 cases, but that's over a period of about 3 weeks. And according to the CDC numbers in West Africa, those numbers are also going up. There's the beginning of some concern, which I would just alert you to. The numbers in West Africa in the past 2 weeks of new cases, new infections, has gone up 42%. That's fairly strong. So these are just trying to get you to understand what this data all means and why they're important. Okay, next slide.
Hey, Sarah, just so you know, we have a few questions coming in. Did you want to wait into the question slide and keep going?
Oh, I'll answer a couple now.
Sure, okay. So let me just go to the first one that came through. So RLG, sorry, I don't have your full name as your moniker, so don't know who exactly this is, but if there is suspicion that officialdom, like the official sources, they're massaging data on the pandemic, what should journalists do to ensure accurate reporting?
I need to know exactly what your suspicions are. Typically health authorities in most countries everywhere are independent of the government. The political leaders cannot massage that data. They can massage their interpretation of that data, but they can't actually massage those data. Although I'm going to amend that by saying, when it comes to mortality statistics, and we can talk about that maybe briefly at the end, mortality statistics is a problem in the data right now because it's not as comprehensive as it needs to be, which is a separate issue from what we talked here. Are you saying that the health authorities are massaging the data? I would be rather surprised to hear that. I would not, however, be surprised that some politicians may want to spin the data. exaggerate or put it maybe in a context that isn't very meaningful. But scientists, the data comes from hospitals, and then the hospitals have to report their data in a certain way to the public health authorities. Mind you, it gets a bit more complicated at a regional and local level, which we're going to talk about. But I don't know. Can someone give me a little bit more information on why you think those numbers are being massaged? Do you think the government is actually lying and not reporting the statistics they're receiving from the health authorities?
So RLG, that's Albert. So Albert, if you want to give some more context for Sarah to expound upon her answer, feel free to do so. In the meantime, we had a question from Eric. Can approved drugs from a particular country be used on patients, or can a country only use a WHO approved drug?
Well, every country has to give approval to use drugs in their country. So I would say if it's on a WHO list, there's probably a high likelihood that countries will seriously consider that. But there are regulatory issues in each country on whether or not to allow certain drugs. So I think you also always have to check with your national health authority to see whether or not a particular drug can be approved for use in your country. Even if it's on a WHO level, you should double check with your national health authority.
And so we have a clarification on Albert's question. Lambert jumped in and said that he thinks that it's not about massaging data per se, but managing it in a way that it's being released in bits and pieces. So maybe not in real time and not giving all the data all at once.
Okay, and that's a problem. You're right about that. I mean, I think you need to, every health ministry, every government right now. But here's what I don't know, and this is what you need to find out. Is it because there is a lag in them receiving the data, or are they actually holding off and withholding the data that they have? Those are two separate issues. Now, there are lots of problems. Like I said, data is a big part of the problem for this story now, and actually getting the right data, getting data that can be compared, getting data in the way that it should be gotten. So the problem could be in one of two areas. It could be either in the way in which it's being collected, where there's a lag, or it could be the fact that the government is delaying it. And I'm not sure which. You need to get to the bottom of that.
Mm-hmm.
And if there's problems in collecting the data, you need to find out what those problems are specifically, and what the health authorities are going to do to do a better job of collecting that data in a more timely way. You need to find out where is the bottleneck? Is it in the collecting of the data, or in the reporting of the data? And is it really a problem on the part of the government withholding information, or is it more that they're getting it late?
And we have one more comment before we move on. So from Kwame Menza at Atakrade, he's just saying that the self-quarantine issues and its relationship with the spread of the virus. He had a comment on that. And he's like, one presumes that those who are being told to self-quarantine are not doing so. So there is a need for government to ensure such persons are monitored. So that's a concern, I guess, being reported on.
That's very important. You're absolutely right. I mean, here we're just talking about data rather than talking about things like testing, tracing, and isolating. Those are other things that I'm going to talk about. So we'll talk about that. Okay. I will deal with that in coming slides. Okay.
Perfect. All right. So let's move on.
So I think these are some of the questions that you want to keep in mind, that you want to regularly ask health authorities and government authorities. As I understand it, and correct me if I'm wrong, the government had a lockdown in place in Accra and Kumasi and has recently eased that lockdown, if I'm right about that.
Correct.
So the next slide. So these are going to be questions about easing lockdowns, going back into lockdown. This is going to be a story that's going to wax and wane as the disease wax and wanes for as long as we find ourselves in a situation where there are no treatments and no vaccines. So I think I wanted to put together what I think are a list of questions that you need to be asking your government authorities as they consider whether or not to tighten or ease restrictions. And one of these is a question from Naomi that I think is really absolutely a crucial question. Does the government feel, based on the way the disease is progressing through the regions, that the disease has reached a peak, or is it still climbing? I think you really need to get an answer to that. That's absolutely crucial. Now, it's very difficult. It's a very difficult question to answer. And I think especially now in West Africa, where broadly speaking, the disease is still climbing. But if they know definitively that the disease is peaked, then you really need to say so. And what is that peak in terms of the numbers of new infections and deaths? What specifically is that peak? For example, here in France, we reached the peak about 3 weeks ago, and it was, I can't tell you how terrible it was. We had about 7,000 daily infections, more or less, and about 1,000 daily deaths. And now, today, we're at about 600 daily infections and about 200 deaths. So you can see, we've come quite away from the peak, and we are not showing any signs of going back. So you need to know, what is that peak number in new infections and deaths? Same thing about the number of people who are in critical care. Of course, do you have enough personal protective equipment and machines available for that peak? That's absolutely crucial. Now, France did not have enough critical care facilities, and they actually had to send patients to neighboring countries, to Germany, to Switzerland, to Belgium. The whole system was overwhelmed. And that's, of course, one of the key indicators of a system under stress is the number of beds in the ICU, which also prevents other patients from being treated who have other serious illnesses, who need heart operations and so on. Later on, and this is something of more of a long-term thing to track, is what is the profile? We don't really know why certain people are dying from COVID and certain people are living. They are the statistics that your government is keeping now. They're going to be giving to medical researchers, and at some point in the future, you should ask them, what is the profile of the people who are dying from this disease? We absolutely need to know that. What is the reproduction factor that the government is going to use to ease further a lockdown? Typically lockdowns happen in phases. There's a first and a second and a third phase. What factor are you going to use? Is it going to be 1.0? What's it going to be during the easing? At what point is it going to start to be a concern? They do have these numbers. They are getting it from their health authorities. And what is the number of new infections and new deaths that would indicate that the curve has been flattened? And for how long must this be maintained to declare flattening? Now, typically speaking, what health authorities are saying in a lot of countries now is that curve needs to be flattened for about a period of about 2 or 3 weeks. So, I think you can kind of use that as your indicator.
Sarah, just to jump in here, because there's some good discussion happening on the chat box as you're going through this slide. And I think folks just want to let you know, to answer your question on whether the government thinks it's reached its peak. The Ministry of Information did mention, I think it was like last week, that they mentioned the date of April 25th during a press briefing. However, I think folks on this program, the journalists here, are saying that claim has been sort of debunked. It's not matching up with the increase in cases that folks are seeing. Yeah. And they're also clarifying that out in the regions, they're finding that they're getting more real-time data, and the lag they're finding at the national level.
Okay.
And a question to that topic from Kafui out of the Volta region. Should questions on peak number go to experts like health authorities or the government themselves?
When you say the government, you're talking about who? The Information Ministry?
Kafui, can you expound upon that? Because when I see health authorities and government, I consider them the same things. Do you mean health authorities as in experts that are outside of the Ministry of Health? If you can write that down in the... in the comment box.
Broadly speaking, the best person to ask that of is whoever is the official spokesperson for the health ministry on the disease, on epidemiology. That's the person who should be able to answer that.
Mhm.
Broadly speaking, that's the person you should be asking that question. And I'm sure they have an official, you know, they're, according to best practices for the Centers for Disease Control, typically every country should have, as we have in the United States with someone who you've probably heard of named Dr. Anthony Fauci, you have a person who is the lead spokesperson on the disease who is made available to answer those questions or, you know, something similar.
Mhm.
Okay, next slide.
All right, we'll go to the next.
We're going to talk about regional data because that's a very important point, what you're saying. We're going to talk about that now. So this is just the thing about 1.0. There's also another statistic which is starting to be used called the rate of transmission, or RT, which is known as the effective transmission rate. And these are just two numbers for you to track, RO and RT. Let's go to the next slide. So let's keep going because I want to get to this regional slide. I think it's coming up. So these are the things, you know, the daily, what do you really need to monitor on a regular basis? Obviously the daily infection rate. I don't know how, looks like the government's putting up its information pretty regularly actually, whether it's growing exponentially or sharply over a period of at least 10 days. One thing that I noticed that I was looking at your numbers, I think it's worth asking about, asking the person in the health ministry who's the spokesperson. I saw that your infection rate is really going up. I think it was 2.1 and now it's 3.46 for those who are under regular surveillance. I think that's a question you need to ask them. Why has that number been going up through time? That's not on here, but it's on another slide. I think you need to find out. I understand that there is that the testing centers are overwhelmed. Again, this is not a problem unique to Ghana. This has been a problem in many countries, including the U.S. But I think you need to find out why is there a lag in these results? What are all the bottlenecks? And what is the government doing about it to try to speed things up? This is absolutely crucial because without timely health data, it's very difficult for policymakers to make the kinds of decisions that they need to be making regularly, either to ease or to tighten up on restrictions. You really need to find out what that bottleneck is. I know that part of the bottleneck has to do with a lack of reagents, which I'm going to get to in a moment, but that may not be the only bottleneck. So, and the one critical issue for Ghana, I think, and for other African countries that you need to ask yourself on a regular basis is, you know, with the strict early measures, this is the theory right now, but it may not end up being the case when you see what's happening in Russia and many countries in Latin America. Will African countries avoid the widespread epidemic or not? You need to ask yourself that regularly, and you need to ask all the experts with the best available data whether or not you think we can avoid it. If we're talking about a 42% growth in new infections in West Africa, boy, I think you're getting to the point where you really need to start asking experts that question. Okay, next slide. So here's questions on easing the lockdown. I think we need to go back a little bit. Yes. This is what seems to be the way in which countries are deciding on whether or not to put a lockdown in place or to take it off. What is the estimated number of cases of new daily infections and daily deaths that will determine the next stage of a lockdown? Now, for example, in France, everything is predicated on there's a minimum and a maximum of the number of cases. So, for example, here in France, they've set the minimum number of cases at 1,000, maximum at 3,000. Everything is based on that number of new infections then, on how whether the health system can adequately handle the number of new infections, the number of people showing up in intensive care units, the number of contact tracers that they need, the number of people to conduct tests, the number of people in the test centers themselves to actually find out and get those test results. Everything in the whole health supply chain is based on that minimum and that maximum. So once you know what that minimum and that maximum number of new infections and deaths are, you need to know about the country's capacity to handle that. What is the daily, how many daily tests do you need to conduct for that number of new cases coming out and new deaths? And do you have enough people to actually give those tests? How many people do you need to give those tests if you have 3,000 new infections, for example? And do the people giving the tests have adequate personal protection equipment to give those tests? That's absolutely crucial. Do you have enough beds in the intensive care units for 3,000 new cases that could turn into, usually the death rate in your country, I understand, is about 2%. Do you have enough beds for that 2%? If there's a flare-up of the virus in a region in Ghana, what is your strategy to contain it? What they're looking at doing now in a lot of countries who are starting to ease lockdowns is doing localized lockdowns. So for example, if there's a flare-up in a northern region in Ghana, what's your strategy to make sure that you can get enough contact tracers up there? You can get enough isolation units for people who cannot self-isolate at home, quarantine units, to have enough testing facilities to test the cases. What are you putting in place to be able to have this kind of strategy that can respond in different parts of the country when this disease could have an outbreak in other regions? It's also good, I think, to know now what is the mortality rate of deaths per 100,000 people in your country. This is another way to track where Ghana rates versus other countries in Africa, neighboring countries, or countries in the world with the number of deaths. And the number of deaths can tell you many things. It can tell you things about the functionality of the health system, whether or not people are being adequately tested in enough time, getting the right care that they need. So it's important to know that. It's a barometer of how well Ghana is actually going to be handling the pandemic. And I think something you should find out, and it could be quite interesting for you to find out in your discussions with health experts, is what other countries are useful for Ghana to compare itself to. They're a similar size with a similar profile, so that when you look at that mortality rate, it will start to make sense. Okay, next slide. We're going to get into regional data, I think, on the next slide.
So Sarah, there is a question that came in that kind of pertains to this slide. Did you want to take it now, or? Sure. Perfect. So Marie has a question on how to report so the public pays attention and doesn't become complacent. Her question is, should journalists focus on reporting numbers? Does that help in getting people to adhere to precautionary measures, I guess, when a lockdown is lifted? What she realizes that in the past days, as the numbers increase, complacency sets in because now people think so many people are infected, but death rate is still low, so the situation isn't as scary as it seems.
This is one of the big problems with this pandemic, and with any pandemic, to be honest. If it doesn't affect you personally, in your patch, in your family, in your neighborhood, in your life, it starts to feel a bit virtual. And you're absolutely right. Complacency can set in. What we're going to talk about in the third part of this course is ways to do just that. What kind of stories can you do that will continue to bring alive to people the tremendous toll that this disease is taking on in the lives of many families? So I'm going to show, and of course, for me, I spend a lot of time looking at the best examples of that, but I think it's telling those human stories, and I think I'm going to show you some examples of what I think those stories are, to elicit compassion. I mean, some of the stories that have moved me the most, and I'm going to show you some of them in the third section, are those that show how much people who really get this disease bad, how they suffer. It's unbelievable. Actually, I think something everybody should do, this is just a bit of homework if you have Netflix. There's an incredibly good documentary series called Pandemic that was actually created before this pandemic. It's, I think, a 4-part series. And you see in that different pandemics that have happened in Asia, Asian countries, and you see the way people suffer once they end up in an intensive care unit. It's unbelievable what people are going through with COVID-19. I've just seen some incredible stories. So I'm going to share some of those with you in the third episode. Okay, next slide. Now, you're absolutely right. Many journalists are frustrated with the lack of responsiveness in national data. This is also true in the US, by the way. The data that we're getting in the US from the Centers for Disease Control is threadbare. It doesn't give them the snapshot that they need on a state-by-state basis. As a result, journalists have banded together in the US and they've created something called the COVID Reporting Project, which I'm going to give you the website address for. I think it's interesting for you to visit. So they also are going to regional authorities. But here's the problem with that. And this is something that you need to look to in depth, and you need to talk to health statisticians. And that is, regions may be reporting different kinds of information in different ways. And the data may not all be reliable. And you need to really get an in-depth understanding of these statistics to find out how reliable they are and whether or not you should be reporting these data. Now, in the United States, we have this patchwork system where different states are reporting different things. And as a result, these journalists, and there's like 500 working on the COVID reporting project, have decided that the data are too dangerous to give to the public. It's going to confuse them. You cannot make comparisons between one state and another. And I don't know what the situation is in Ghana, but I think before you move very rapidly onto getting data from regional authorities, you need to talk to health statisticians, understand what this data is actually telling you, understand how accurate it is, understand how timely it is, and whether or not you should be using it, because bad data is something else. So you need to actually find out how reliable is the data, how timely, how comparable it is by talking to statisticians, sharing with them. I'm sure they're fully well aware in Ghana of the kinds of data that are coming from the regional or municipal authorities before you start to report on a regular basis. I realize I'm asking you to do a fair amount of homework, but health is a life and death matter. And you do not want to scare people when they shouldn't be scared, and you don't want to make them feel good when maybe they need to be concerned. So you're going to need to actually do your homework by talking to statisticians, sharing this data with them, finding out what it's all about. You can go to the COVID reporting project and maybe, even though it is US data and it's different, get an understanding, or maybe even contact some of the journalists working on it to get some insights before you move too fast on this level. I understand your frustration. I do, but the data have got to be good, they've got to be reliable, they've got to be solid, and they've got to be comparable. So that's what I would say about regional data. These are some other questions that I think you need to know about data. You know, patterns detected in infections, that's more of a long-term issue. What kind of a surveillance strategy does the government have placed for the general population, not just for those who have been diagnosed with it? Something to remember, I think, for you, because Ghana is a little bit earlier in this wave than other countries, that usually the cases are the most severe in the beginning stages of an epidemic, and same thing for the number of people who die from this. And these rates, both of them tend to fall through time. Something that I'm going to provide you with, which, as I said, the information is coming out so rapidly. People are learning so quickly about what's happening in the pandemic. Is there's a new statistic coming out on what was now called excess deaths. And that is deaths that are related to COVID. People who died at home because they didn't know they had the disease, for example. People who died because they were afraid to go into the hospital and they were feeling ill. These are all related to COVID mortality. And as a result, in places like New York, which is a hot zone for the disease in the United States, they have actually doubled, and they're now thinking they could triple or quadruple the number of COVID and COVID-related deaths. This is an emerging hot issue in data that we're just beginning to get a handle on. Also, do your statistics on new infections and deaths in Ghana. Do they include other parts of the health system like care homes? For example, here in France, the disease didn't look too bad until people started complaining and saying, but you're not putting in all the healthcare facilities that are not hospitals. And the minute the French put in the other care homes available in France, the mortality rates and the infections doubled. So these are things to be also aware of in the data. Any questions? I'm being a bit orthodox about this, I know. I know as a journalist, you want numbers. We all want numbers, but they've got to be reliable. They've got to be good. They've got to be comparable.
So no new questions at this time.
Okay, well, we'll move on. And in terms of time, Naomi, how are we doing?
We're doing pretty good. We still have a little over 20 minutes.
Okay, because I want to be able to take questions at the end, but so I'll maybe do another 5-10 minutes and then take some questions at the end. How's that?
Perfect. So as a reminder, everybody, please type in your questions in the chat box. So we don't want to get to the end and you guys run out of time. Let me go to the next slide.
So these are the things I'm going to ask you to look into with your regional data. You know, are they reporting on hospitalizations, number of people admitted into intensive care unit? Do they report not only on the deaths taking place every day, but how they're accumulating over a period of time? Do they report on the number of people who have recovered? Are they reporting on testing information, those who are testing positive, those who are testing negative, those who've been tested more than once? All of these things can change the statistics. The testing information, what does this include? Does it include people with symptoms, those who test positive? So again, you need to, I think, develop among yourselves a list of good public health statisticians who you can consult and ask them about this information. Once you get the information together, you know, it might even be interesting for you as a country if I could get you to do a project in common, and each respective region to do their homework on what data is available, put it together in a giant spreadsheet or however you want to compile the data, and then meet with health statisticians and say, here's what we've got, please tell us whether we should be using this data, whether it's reliable, what you do when you don't know about this information. And maybe do it as an entire country. Each one of you taking responsibility for your respective region could be quite interesting. So anyway, these are some of the data issues to think about when you get your regional or even your municipal data. Okay, next slide. This is just something I want to remind you of. You know, this is a pandemic. This is a new disease. We don't know much about it. We don't know why some people get it and some people don't. We don't know why some parts of the world seem to be hot zones and then some not so much. We don't really know much about symptoms. You know, the symptoms that the CDC in the US tells us we should watch out for in case we have developed the disease is changing. For example, we don't really know what kind of drugs could help relieve symptoms. Even the symptoms themselves are changing. In the beginning, everybody thought this was a disease that, you know, in its severe state really affected the lungs, and therefore machines like ventilators were very important. We now know that's not true. People are having heart failure, they're having kidney failure. Children are reporting an inflammation of their vascular system. So the disease is affecting them very differently. So you need to keep in mind what I call the uncertainty principle, which is, what do we know about this disease and what don't we know? And you need to ask yourself that on a regular basis. What do we know and what don't we know? And this may sound counterintuitive. Journalists think they need to go out there and get all the answers, but actually that's not true. You need to remind your readers of what we don't know yet, because we don't want to give them a false sense of confidence. And actually, counterintuitively, that's how you get them to build confidence in your reporting. This disease needs us as journalists to also be very humble. We don't know all what's going on. And it's a very fast-moving story. Things could change in Ghana. If we were having this discussion a month from now, things could be very different. So it's a very fast-moving story with, you know, very big twists and turns in what the scientists are learning, what the doctors are learning, and what the statisticians are learning. So I'm going to show you on the next slide, I think, a demonstration of what I mean by the uncertainty principle. Ed Young, who I pointed out as one of the best reporters on the science and the medicine of COVID-19, has a piece that I want you all to read. It's an incredibly good piece. It's called "Why the Coronavirus is So Confusing." And he did a whole piece that is about just that. What don't we know? Why don't we know it? So much about the pandemic is still, this is from history, is still maddeningly unclear. You know, why do some people get it, but others don't? Why are some of the models that we are using to predict the spread of the disease too optimistic and some are too pessimistic? Really, how transmissible is the virus? How many people actually have been infected? How long do social restrictions need to go on for? And why are so many questions still unanswered? He did this piece that actually went through and unpicked each one of these questions, trying to give the best available information to say why we don't know what we don't know. So next slide. So I would say to you, take advantage of the fact that the paywall has been dropped in the US. And I was a reporter on staff for the Associated Press. We have a technique that we have to use. It's called reading in. When I was an editor at AP Dow Jones in New York, which publishes about 13,000 stories a day worldwide by 1,200 journalists based in 126 countries. When I was an editor for the Newswire, I used to go in before I would start my shift, and I spent an hour before my shift started reading the last 24 hours of all the news that took place all over the world for the past 24 hours. I had to. How could I possibly know what had been happening over the course of the day? The point being that it's a certain discipline that we use in the US. And I would say to you, please dedicate a few hours, perhaps at the beginning and the end of each week, to read the best available reports coming out on all aspects of COVID-19, on how it's spreading, on treatment, on cures, on disinformation, on the countries that are doing well, on the countries that are doing poorly, and why. What you can do, and this is, I'm just giving you one of my own techniques, I'm happy to share it. There's a free software called Evernote. It's evernote.com, which you can download and download their web clipper. And you can create files for each topic concerning COVID-19, and you can clip the articles by topic into each notebook in Evernote and refer back to them. So I would say to you, this is a very fast-moving disease. Things are changing every day. The way that we approach things is changing every day. And we have to stay on top of it. So at least twice a week, I would ask you to do a very in-depth read-in of all the best sources that are available. That includes going to the World Health Organization pandemic preparedness page, going to all the top pages that have all the very best available information, reading everything that new has taken place since the last time that you visited. Next slide. Now, Naomi had told me, and I think it's really important, to me, this is a critical issue for Ghana, which is the backlog in testing. To me, this is a very important story for the country for you guys to get to the bottom of. Because without accurate data, it'll be impossible to really be able to chart the true spread of the disease and to take the kind of timely measures that you need to keep this disease from spreading further, to keep it in check. So I think, you need to ask, what are you doing about this backlog in testing? Now, this is based on some of my reading in about testing backlogs and what some of the solutions are in other countries that perhaps you could ask your health ministry about. For example, reagents are in short supply all over the world, not just in Ghana. There's a supply bottleneck in China, where most of them are coming from. Can you borrow these materials from research labs that don't need it? For example, are there alternative agents or other extraction methods that you can use? Can you change your guidelines so that you can use less reagent than the amount that's now being under consideration? So these are some of the questions you can ask about the problem with reagents, but you need to ask them, what measures are being taken to ramp up the capacity of your testing centers and to secure supplies of these reagents in the middle of a global supply squeeze? These are absolutely crucial questions that need to be answered and answered now. In addition to reagents, there might be other bottlenecks. Make sure that you know the full scope of the problem. There could be other problems. Is there a problem, for example, do you need more testing centers? Do you need more people to be trained on how to conduct the tests. You know, find out where all those bottlenecks happen to be. And then more long term, you know, what measures will the government put in place to have an adequate stockpile of reagents for future outbreaks? At some point, you need to ask that question as well. The whole world has been caught off guard by being overly reliant on a single supplier, in this case, China, for reagents. Does Ghana have a stockpile? What are you looking at to strengthen your pandemic preparedness plans so that this doesn't happen again? I think that has to be one of the questions that you ask. Okay, next slide.
Sarah, 1 second, I just need to make an announcement. So it appears that our chat box is not working for everyone. So what we're gonna do is that once Sarah finishes her presentation, I'm gonna stop sharing the screen and we'll, I'll call on people when you guys raise your hand so you guys can ask your questions like that, okay? Sorry about that.
Okay, right. Next slide.
Mm-hmm.
So here's some other parts to the backlog problem, some of the other solutions that are being looked at, you know, maybe involving labs in other countries, for example, using academic or commercial labs. And I think one person could be very interesting to talk to is the head of the WHO for Africa. Apparently Ghana is one of the priority countries that they use to scale up diagnostic capacity. And I think some journalist in this group needs to ask him, you know, why there is this bottleneck, because they did make Ghana a priority country in testing capacity. And why hasn't this worked? And I think he's one of the people that I think you definitely need to ask these questions of why hasn't it happened. I will say to you, just based on my own reporting on Ebola, that during the Ebola crisis, the WHO was very slow to respond. And I don't know if that's the case again in this pandemic, or if they have put in place a system where they have responded more quickly, to be fair to them. But they did have a reputation in the last epidemic in Africa of not moving fast enough. So I think he's somebody needs to have an interview with about the situation in Ghana, because the WHO was involved in Ghana. So, okay, next slide. These are just a few other resources that I think you need to go to for data. I know you're frustrated, and until you get this situation resolved with the backlog and information provided by the national ministry, and whether or not the regional data is something you can rely on or not. Here's some other places to go for data. They don't offer a lot of data, but it is reliable data. Go to the COVID tracking project. That's the journalist-led initiative that I was telling you about. That's only on the US, but I think it could offer you some interesting tips in understanding your regional health authorities. Johns Hopkins University is where most international journalists like myself go for reliable data. They also have an international page. It has information on Ghana, and they have a very interesting page to read, which is called Testing Insights Initiative, that may also give you a place to learn about testing and best practices. Certainly the Center for Disease Control Africa, they have weekly outbreak briefs. I don't know if these organizations are any more timely than your health authority, but it's reliable data. And then of course, visit the pandemic preparedness page for the World Health Organization on a regular basis as a part of your reading in. Another place to visit is the covidexitstrategy.org, which is a very interesting page of public health officials who are constantly talking about what needs to be done to stop the spread of the disease. And like I said, know the nitty and the gritty of your health statistics at your regional and municipal level. Next slide. And just a few pointers. You probably have, I think, regular health briefings. I think one question that's an interesting question to ask. I heard this in a White House health briefing not too long ago. Don't forget to ask open-ended questions. They can get more information, and sometimes officials feel less threatened, and you can actually learn more. And I really like this question that was asked in a recent briefing, which is, what does victory look like? You know, this is a pandemic that's going to go on for years. So what does victory look like on a regular basis for the health authorities in Ghana? Like I said, I think you need to look into this, why the positivity rate from routine surveillance is rising. I think that's something that's important. In these health briefings, figure out what your most important question is that you want to put in front of these authorities. And if they don't answer it the first time, before you go into that briefing, come up with at least 2 other ways to rephrase the way that you ask that question. And persist, but be polite, be firm, and be neutral. And see if you can get an answer to some of those tough questions. Make those questions brief and direct. And just, I think sometime, if you have some spare time as part of your reading in, I think it's a great exercise to go to YouTube and look at some of the White House briefings, health briefings. They're not taking place every day now, but there's quite a number of them to look at. And just listen to the way the journalists ask their questions. Some of them will be US-centric, but others, I think, are going to be ones that you could maybe recast and use in your setting in Ghana. Next slide. I would say I understand that in Ghana during the Ebola crisis, you guys put in place a great system to share sources. I think maybe this is time for you to think about this again. Share resources on doctors who will talk to you is a great thing to do. You know, we are in the middle of a world crisis, the likes of which I have not seen in my lifetime, and I hope I never see again. Maybe this is a time to share your information with each other by creating a WhatsApp group. Share facts, share sources. We're in a competitive business, but there are times when we need to put this aside and work together. So I would ask you to think about ways that you could work together as a group, and one of them would be to share resources through creating some kind of a WhatsApp pandemic group. And I think that's it, Naomi, and I can take some questions at the end. Yes. This is just something, as I said, every day I'm reading about this kind of thing. There's not been any hard data about the use of masks. Now there is. Why? Well, because as I said, thousands of researchers are conducting studies. So now, and I just put this up as an example, now there's some hard research that actually shows that wearing surgical masks on the part of citizens also can help prevent infected people from making others sick. Well, this is good to know. So this is a rapidly evolving sort. The science is evolving every day. The treatments are evolving every day. The spread of the disease, what we know, is changing every day. So it's a hard assignment to stay on top of it. But I would say that this is probably the most important story being covered in every country, and we need to do it and do it well. Okay, thanks very much. I'll take questions on the information now from any of you. For what, the next 5-10 minutes, Naomi?
Yes, so let me just stop sharing. We managed to fix the chat box, so that's good.
Great.
But so guys, submit your questions. We got a lot of really good information from Sarah. I know you all have a bunch of questions, I'm sure. We do only have 10 more minutes left.
Let me just offer this as well. If there's some questions that are really burning questions that I don't get around to answering it, I'm happy to have Naomi send me an email of those questions and then send to her some of the answers that she can circulate to you. I'm happy to do that.
Thank you so much, Sarah. And just a reminder, this is the first of a 3-part series. So we'll also have 2 more sessions. So Mutala asked, globally, have we peaked?
Well, that's a very important question, but I'm not a health expert. I'd have to ask a health expert about that, but I would just tell you my own view, and I don't want you to report this because you need to get health experts to do it. No, the disease is climbing everywhere. You know, for example, in the United States, it looks kind of like it's plateaued, but that is not the whole situation because certain parts of the country are seeing very sharp outbreaks. Other parts of the country are seeing the disease go down. You can't call that a clear situation, and that may be happening in other countries. For example, here in France, the nationwide statistics are showing a clear downtrend. This is true. But already last week, since they started to ease lockdown, already 2 regions are now becoming fresh hot zones. Or look at Germany, for example. Already they're showing a rise in cases. Is it getting to an alarming place? We don't know yet. So I would say no. in no way could we definitively answer that question and say that it has peaked. I guess I would have to say that.
Okay, we have a question from Kazitu. What would you say is the best way to verify data on the fly, considering that this information is subject to change by the minute?
You still have to stick to the best available data from the national health authorities, the World Health Organization, the CDC, and Johns Hopkins. You have to stick to the good data. They're updating. I'm sure that they'd like to update it as fast as they can. We still have to stick to good data as journalists. And I think we're frustrated, and I think it's not a bad idea to share with your readers and your listeners information. This is the lag time in the data, and you need to know that. Be transparent. This data is this timely and not more timely. And I think, to be fair to the government, if it's not timely enough, I think you need to compare Ghana to best practices on divulging data. Are they in line or are they not? And if they're not, say so. And if they're not, you need to also find out from the government why they're not and what steps they're taking to be more timely. To be honest, this is a huge problem. It's been a huge problem in the United States. So, okay. Next question.
So we have a question about reusable face masks. This might be a question more so for the health authorities, but the question is, so the reusable face mask, what is the expiry date, as we hear it may be a major cause of infection if not used well. Some say after use and washed 3 times. This is from Kwame from Takoradi.
I think, once again, these things are rapidly evolving. Just like that story that I just put up on the slide about the piece of research about surgical masks. These things are being studied right now. You need to find the best available expert who's studying this, who can tell you, again, what do they know and what don't they know? I'm not so sure we have an answer on that. In France, for example, I don't know if you want to go to the Ghana Health Authority and rely on them, or if you want to rely on the World Health Authority. You have to rely on a top health authority for their information. The French Health Authority is saying, for example, on reusable masks, which we are now required to wear when we go out in public in shops, we can wear them for 4 hours of use. And then after that, they need to be laundered. But is it based on science? I'm not sure. I would take it to the scientists, and then you need to get the best available information by the best available health authority, nationally or globally.
Mm-hmm. Okay. This is a very interesting question. Is it right for journalists to report on where COVID-19 patients are being kept in a community?
I don't know why that should be a problem. I mean, the government is setting up facilities. They have hospitals that have COVID units. They have set up special quarantine facilities. I know what the problem is, and it's a global problem, including, in the US and France, everywhere. People are attacking health workers because they're afraid that they're spreading infections, and they're attacking COVID patients. And so therefore, people are afraid to report these facilities because they're afraid that it could lead to outbreaks of violence. And I can understand that. But these are public health facilities, right? I think with your reporting, you need to also be very careful and let your readers or your listeners know that, they shouldn't stigmatize these people, and especially healthcare workers who are putting literally their lives on the line for us. You need to find some way in your reporting to point that out so that people don't stigmatize these people. But we know where these facilities are. I mean, for example, we know in London, for example, they have built a giant new hospital in East London that has 5,000 beds because they thought that the disease was going to continue to grow exponentially. Well, everybody knows where that hospital is. I mean, these are public authorities. So, yes.
Another question from Lambert: how do we deal with information overload during this period? Should journalists put out every single thing gathered on COVID? I believe you talked about this a little bit. during your presentation, but if you had anything additional to add.
Well, what do you load? I mean, I think that we have to stick to what is the most important information that, and I think we have to make this determination. What's the most important information that our readers and our listeners need to know on a regular basis? They need to know what's happening in their community. How many people are getting sick? How many people are being tested? How many people are being treated? Is the health system adequate enough to handle it? Do we have a handle on the disease? How well is the government handling this pandemic or not? What are the gaps in healthcare? What are the gaps in testing? What are the gaps in treatment? I mean, I think you have to make a list of what are the most essential kinds of information that you need to be reporting on a regular basis. And beyond that is beyond that. Okay, you know, and I think things like, for example, I think you also do need to give your readers and your listeners information on anything that's looking promising. Like, for example, what are the drugs right now that are in clinical trials? You know, could be promising, like Remdesivir, for example, which is one of the medications that was used in other epidemics. You need to give them a little bit of hope too on, you know, where do things stand? There's a, you know, what are the clinical trials taking place on the most important, most promising vaccines, without telling them, you know, in any language whatsoever that it's going to work. For example, Donald McNeil, the New York Times reporter, points out, quite rightly, that the fastest we've ever as a world been able to develop a vaccine for any epidemic was for the measles, and that took 4 years. And if you recall, we have never found a vaccine for HIV/AIDS. It's important. This is going to be hard. Even if you have every country in the world developing every possible resource, that doesn't mean we're going to find a treatment. You'd be very skeptical about that. But, you know, telling the very latest about treatments and vaccines, I would also put on that list. You can make a list of what you think are the most important issues that you need to be reporting on regularly, and everything else is everything else. But to me, that's what the list would look like.
Great, thank you, Sarah. And I think we have time for one more question. So we're going to go with how do we promote behavior? Oh, wait, sorry. How do we promote behavioral change in the community without creating fear and panic in the reporting?
Well, I think one of the things that a lot of publications are doing, and I think it's really important, is that you have somewhere on an online news site or in your newspaper or, you know, on a website for a broadcaster, that you regularly provide the information over and over and over again about what they need to do to prevent themselves from getting the disease. You know, all that's, you know, maintaining self-distancing, washing your hands, coughing into your elbow. You need to make those public health messages very prominent in your news organizations over and over and over and over and over again, so that people know this is what I can do, you know. And so, and there's ways to do that. I know, for example, the New York Times, at the end of every article on COVID, at the bottom, there's a little box of links that you can click on. What do I need to protect myself against the disease? There's 2 or 3 of the questions that people want to know. So I think that's one of the responsibilities that we have in the news organization, is to repeat over and over and over again those messages. Frankly, not just because people get lazy and they need to be reminded of it. Here in France, for example, they did a little test and they let people walk along the Seine. And what happened? People are walking too close together. Guess what? The parks are going to stay closed. We have to remind people again to keep that distance of 1 meter or 6 feet. So I think that's what we can do.
All right. So before we conclude this first session, Sarah, did you have any parting words to the participants?
Well, I think that, you know, if you have other questions, please, Naomi, put them together in a note to me, and I'm happy to answer them. And also, I will be sending you my presentation. You have my email. So reach out to me if I can be of any help, really. This is a global pandemic, and we need to work together.
Well, thank you so much, Sarah, and thank you everyone for joining. Before we leave, I just wanted to get a group photo since we're doing this virtually. So if you want to be in the photo, you can take yourself off of no camera. You can turn your camera on, and we'll be taking the photo. So as people get prepared to do that, I just wanted to say a warm thank you to ARS-Paris. Thank you for putting this together. Like I said at the beginning, this is a 3-part series on reporting on COVID. The next two will be, the next one will be next Wednesday, same time, 11 a.m., Wednesday, May 20th. And the last one will be May 27th at the same time, 11 a.m., and same sign-in. So we hope to see you all there. All right, so everyone's had plenty of time to take themselves off of no video. Thank you, I love seeing all your faces. I'm going to take a picture. Hopefully it will turn out. All right, everyone smile. 1, 2, 3. All right, thanks everybody. So if you haven't done so already, please put your full name, your region, and your media outlet and email address so that we can keep track of who showed up, and we can send you the presentation following this. And just so you know, as a reminder, this was recorded, so if you want to go back and watch the session or share it with your journalism colleagues, feel free to do so. We'll also be sending around that link as well once we have it uploaded on the Embassy's YouTube page. So thank you guys so much for coming. I look forward to seeing everyone here next Wednesday. Be sure to tell a friend, a journalist friend, and let me or Joyce know any feedback or how we can make this better. All right, thank you so much, and thank you, Sarah.
You're welcome.
See you guys next week.